Hello, I'm Dr. Mitchell Grayson, Professor and Chief of the Division of Allergy and Immunology in the Department of Pediatrics at Nationwide Children's Hospital and The Ohio State University. I'm also a Fellow of the American Academy of Allergy, Asthma, and Immunology and a board-certified allergist. So, every time you play basketball or any strenuous activity, you get short of breath, cough, and maybe wheeze about 5 to 10 minutes into the activity? Why is that? Well, it sounds like you might have exercise-induced bronchoconstriction, or EIB. EIB is a little different from asthma that is exacerbated by exercise. EIB tends to occur more rapidly after the start of exercise, usually within 5 to 10 minutes, while asthma exacerbated by exercise tends to occur more like 30 minutes into that strenuous activity. One way to think of this is it's kind of like the difference between getting short of breath in the first quarter of a basketball game versus at halftime. EIB is thought to be due to rapid cooling and drying of the airways, leading to constriction of the breathing tubes. Often, slow warm-ups and wearing a scarf or some other face covering when in cold will prevent the symptoms of EIB. However, in some cases, medications, such as a bronchodilator, are needed that are used before exercise to keep your airways open. There are certain sports, like swimming, that are much less likely to cause EIB, probably because they occur in warm and humid environments. In general, EIB is diagnosed in people who do not have any other symptoms of asthma at other times. However, asthma can exist with EIB, and if you do have asthma, it is common to have your breathing symptoms get worse with strenuous exercise. This is more likely if your asthma is not well controlled at the time of exercise. Your doctor will likely prescribe a controller medication, some sort of an inhaled steroid or leukotriene antagonist to use regularly if you have asthma. In addition, you will likely get a bronchodilator to use 15 to 20 minutes before any strenuous activity to prevent your asthma symptoms. Regardless of whether you have EIB or asthma exacerbated by exercise, your doctor will likely give you a bronchodilator to use to treat any symptoms that might develop during or immediately after exercise. Your local allergist is trained in diagnosing and treating EIB and asthma. She or he has the expertise and the know-how to make your symptoms much less of a burden. So, if you are suffering from shortness of breath or wheezing, I most strongly encourage you to go see an allergist today.